Hi, let me ask you a simple question. When you go to sleep at night, do you usually lie on your back, on your side, or on your stomach? Most of us never think about this, but the way you sleep can quietly influence your comfort, your breathing, your back, and even how rested you feel in the morning. Today, I want to walk you through the most common sleep positions, what they might be associated with, and how small changes can make a big difference. No medical background needed, just real-life explanations. Let's start with sleeping on your stomach. If you're a stomach sleeper, you're definitely not alone, but this position can be tough on your body. When you sleep on your belly, your neck is usually turned to one side for hours. This can strain your neck muscles and put pressure on your lower back. Many people who sleep this way also report tossing and turning more, because it's actually harder for the body to fully relax in this position. If this is your favorite way to sleep, using a very soft pillow, or even no pillow at all, may help reduce neck strain. There's also a specific belly position called the Freefall position. This is when you lie on your stomach, hug a pillow, and turn your head to the side. Only a small part of the population sleeps like this, but some studies suggest these sleepers may be more outgoing and expressive. Still, from a physical standpoint, the neck and lower back often pay the price. Now let's talk about sleeping on your back. Sleeping on your back can be comfortable, but it's not ideal for everyone. For some people, this position can increase lower back pain, especially if the natural curve of the spine is not supported. Back sleeping can also make snoring worse, and in people with sleep apnea, it may increase breathing problems during the night. If you sleep on your back and often wake up tired, or your partner complains about loud snoring, this might be worth discussing with a doctor. There are two well-known back sleeping styles. The first is the soldier position, arms straight down, body very still. People who sleep this way are often described as quiet, reserved, and self-disciplined. The second is the starfish position, arms up near the head, spread out. This position is less common, but some research suggests these sleepers may be good listeners and supportive friends. Now let's move to the most popular category, side sleeping. Side sleeping is generally considered one of the healthiest positions, especially for breathing and spine alignment. The most common version is the fetal position, where you curl slightly with your knees toward your chest. More than 40% of people sleep this way, and it's especially common among women. This position can feel very comforting, but curling too tightly may restrict deep breathing, so staying slightly relaxed is better. Another side position is the log. This is when you lie on your side with both arms straight down. People who sleep like a log are often described as social, easygoing, and trusting. Then there's the yearner position, side sleeping with arms stretched forward. Some studies suggest these sleepers are open-minded, but once they make a decision, they tend to stick with it. If you sleep next to a partner, you may recognize spooning. Cuddling during sleep can actually release oxytocin, sometimes called the bonding hormone. This hormone can reduce stress, help you feel closer to your partner, and even make it easier to fall asleep. Now let's talk about specific situations. If you snore, sleeping on your side is usually the best choice. If you prefer sleeping on your back, using extra pillows to slightly elevate your head may help. However, very loud snoring, gasping for air at night, or extreme daytime fatigue should never be ignored. If you have back pain, side sleeping often works best. Placing a pillow between your knees can reduce pressure on your hips and keep your spine aligned. Back sleepers with pain may benefit from placing a pillow under their knees to support the natural curve of the lower back. For pregnant women, side sleeping is strongly recommended, especially on the left side. This position may improve blood flow to the baby and reduce pressure on internal organs. Using pillows for support under the belly and between the legs can make a big difference. Finally, let's talk about something just as important, your mattress. Even the best sleep position can fail if your mattress doesn't support your body. A good mattress should be firm enough to support your spine, but soft enough to adapt to your shape. Many stores allow trial periods, so don't hesitate to test before committing. So tonight, when you lie down, take a moment to notice how you sleep. A small adjustment, a pillow in the right place, or a different position might improve your sleep more than you expect. Sleep well and take care of your body, even while you rest. Wishing you healthy and peaceful nights.